Today, let's talk about lumbar facet disease. There's a lot of confusion about lumbar facet disease. I mean, people ask, I have arthritis. My God, when did that happen? Well, as anyone who has an old car will tell you, we put enough mileage on it, we're all going to get arthritis, but it doesn't have to hurt. So let's look at our little spine model and let's understand what is facet arthritis. Now, the facet joints, several names for them. The full name is called the zygapophyseal joint. It's a mouthful, or the Z joint. I don't know, I'm not crazy about that term either. I just like to call it facet joints. Now, the facet joints, we have them in our low back, we have them in our mid back, and we have them in our neck as well. Now, the orientation of the facet is different. Like, for example, in the neck, we want to be able to turn our neck easily side to side and up and down. In our low back, we want to be able to twist, but other motions are a little bit more limited. And of course, the thoracic spine is really designed for expanding the rib cage when we breathe. So what is facet arthritis? Now, the facet joint is actually a true joint, just like your knee joint or your hip joint. It's surrounded by a capsule, and it has fluid, it's dynamic, it has a nerve that supplies it. It's a complete miniaturized joint that is fully functional. If you look at this model here, the facets, they rub. And because they rub, actually, it's good that they move. I'll tell you more about that later. But because they rub, they have fluid that kind of keeps that sort of greased, wheel, so to speak. Now, when we tilt to one side, we'll talk about lumbar facets for now. When we tilt to one side, that rubbing can be painful or not painful. So patients who come in with lumbar facet problems, they'll typically say, I wake up in the morning, it's not so bad, it hurts, maybe 4 or 5 out of 10. But when I get going a little bit, it actually feels better. But forget it. At night, I have to sit down. And another thing they say is, when I lean forward, it feels better. Oh, doc, when I lean back or I twist or I reach for something, forget it. It hurts like anything. And they also say, and I ask, well, does it shoot down your leg, the pain? And typically for lumbar facet disease is, yes, it goes down the leg or the thigh, actually. It goes down from the back, it goes down, but it often does not go below the knee. In pain medicine, the knee is kind of like a nice marker because things that are below the knee often are due to some of the larger nerves. And this kind of demonstrates, for example, here's a larger nerve, this could be the L4 or L5 nerve. And if this is a herniation pushing onto that nerve, ouch, doc, I had this sharp electrical pain going down my leg. Now that is clearly not facet disease. So we distinguish between referred pain, which is facet disease, and radiating pain, which is radicular or due to a disc.